Most people think regular health checkups are always a good idea. It sounds like common sense, right? Stay ahead of problems, catch things early. But what if I told you that after a certain age, some of these very checkups could actually put your life at risk? It sounds strange, maybe even shocking. I know, but the uncomfortable truth is this. Not all screenings and tests are harmless, especially as we get older. In fact, some of the most common checkups routinely offered to older adults, folks over 70, can sometimes lead to false alarms, unnecessary stress, and even dangerous, invasive procedures. This isn't fear-mongering. It's a reality that more and more doctors, particularly those specializing in geriatric care, are beginning to acknowledge and discuss openly with their patients. The medical world is slowly waking up to a crucial new reality. A one-size-fits-all approach to testing can actually do more harm than good as we age. Our bodies change. Risks increase. The time it takes for certain slow-growing problems to become a threat often extends beyond our natural lifespan. In this video, we're going to take a close, honest, and compassionate look at 5 specific health checkups that many seniors are genuinely better off avoiding. These are screenings that even experienced doctors often wisely turn down for themselves once they reach a certain age. We'll explore why these tests are still so commonly recommended, the hidden dangers they can carry specifically for older adults, and importantly, the better, safer alternatives that can keep you informed about your health without putting you unnecessarily at risk. You deserve medical care that truly respects your age, your unique body, and above all, your precious quality of life. If you're someone who cares deeply about your health and well-being, but also wants to avoid being overtreated, overmedicated, or overwhelmed by the complexities and pressures of today's healthcare system, this video is absolutely for you. We're not here to scare you. We're here to empower you with knowledge, build your confidence, and help you paint a clearer picture of what truly supports vibrant health and well-being after 70. If that sounds valuable, please consider subscribing and hitting the bell icon. It helps us reach more people like you who deserve this information. Let's begin. Number 1. The colonoscopy trap. Colonoscopy has long been held up as the undisputed gold standard in preventing colon cancer. For decades, the message has been clear. Get scoped, save your life. And for many people in their 50s and 60s, that's often true. It is a life-saving tool. But here's the critical shift that often isn't discussed. After age 70, especially in individuals without any current symptoms or a strong family history, this test can quietly transform from a protective shield into a potential source of significant harm. What was once a crucial preventative measure can, past a certain point, become a gateway to unnecessary risk, immense stress, and even hospitalization. Why is the equation different now? The procedure itself is physically demanding, no matter your age. It involves an intense, often miserable bowel prep process designed to completely empty your colon, a process that can cause severe dehydration and dangerous electrolyte imbalances, which are far more serious and harder to correct in older bodies. Then comes the sedation. The drugs used to make you comfortable linger longer and have stronger effects as we age. This isn't just about feeling sleepy afterward. It significantly increases the risk of lingering confusion, debilitating dizziness, and dangerous falls, risks that persist long after you leave the clinic. Studies like those analyzed by the U.S. Preventive Services Task Force, USPSTF, clearly show that the harms of colonoscopy begin to outweigh the benefits for most average-risk adults over 75, and the risks start climbing noticeably even earlier, around 70 to 75, especially for those with prior clean screenings. But the risks go beyond the immediate physical toll of the procedure. Perhaps the most insidious danger lies in what happens after the scope. Many older adults, particularly those over 75, are subjected to aggressive follow-up surgeries or treatments because the colonoscopy finds small polyps. The crucial point missed is this. The vast majority of these polyps are slow-growing abnormalities. Research consistently shows it typically takes 10 to 15 years, sometimes longer, for them to develop into anything potentially serious. For someone in their late 70s or 80s, those years may simply never materialize within their natural lifespan. Yet, the discovery of these polyps creates intense fear of cancer. This fear sets off a chain reaction. More procedures, biopsies, repeat colonoscopies, and even major surgeries like partial bowel removals. All of this is done in the name of prevention. But when the risks of these interventions, infection, surgical complications, prolonged recovery, impact on independence, demonstrably outweigh the tiny statistical benefit of preventing a cancer that likely wouldn't have caused problems in their lifetime, what was intended as prevention becomes, tragically, a form of harm. Consider George's story, shared by a geriatrician colleague. George was 82, active, mentally sharp, and living independently. He had no digestive issues, no family history screaming alarm bells. Yet, during a routine visit, his doctor strongly recommended one last colonoscopy. George, wanting to be responsible, agreed. The bowel prep left him severely dehydrated and weak. After the procedure, groggy and disoriented from the sedation, he fell at home that night, fracturing his hip. That single preventive test led to emergency surgery, months of painful rehabilitation, overwhelming medical bills, and immense stress for him and his family. The cruel irony? The colonoscopy itself found absolutely nothing wrong. His life was upended for zero medical gain. This isn't about blaming well-intentioned doctors. They operate within a system historically focused on maximum screening. But medicine evolves, and evidence-based practice must evolve with it. If you're over 70, especially with no symptoms and a history of clean screenings, it is perfectly reasonable and often medically wise to decline a routine colonoscopy. Excellent, far less invasive alternatives exist, like highly sensitive stool-based tests, FIT or FIT DNA tests. These are safer, easier to tolerate, and effective for ongoing monitoring in many cases. It's about a clear-eyed assessment, weighing the true physical, emotional, and financial costs of putting an older body through an invasive procedure against the marginal, often negligible benefit it might provide. We must collectively move beyond the simplistic assumption that more testing always equals better care. Because after 70, truly better care often means fewer interventions and far more thoughtful, personalized choices. Choosing to avoid an unnecessary colonoscopy isn't neglecting your health. It's a profound act of honoring your current well-being and protecting your future quality of life. Number 2, the annual full body scan mistake. There's something undeniably seductive about the idea of a full body scan. Imagine a powerful machine peering inside you from head to toe, uncovering every hidden issue before it even whispers a symptom. It sounds like the ultimate in smart, proactive prevention, a technological crystal ball for your health. But for seniors over 70, this high-tech approach is often more of a curse than a blessing. While the intention behind these scans might seem vigilant, the outcomes they frequently produce can set off a terrifying domino effect of anxiety, invasive follow-up tests, and even completely unnecessary surgeries. Interventions that can ironically shorten your life or drastically diminish its quality, rather than extending it healthily. Let's be crystal clear. Full-body CT scans and MRIs are not your typical, targeted screening tools like a mammogram or bone density test. These are incredibly powerful imaging technologies designed to capture everything. Every tiny nodule, every faint shadow, every minor variation from textbook normal. And herein lies the core problem. They pick up a vast number of harmless abnormalities, benign cysts, age-related scarring, insignificant nodules, things that would never affect your health or lifespan. These are called incidental findings. For a senior, an incidental finding isn't just a note in a file. It can become a ticking time bomb of anxiety. A tiny spot on your lung, a small shadow near your kidney. Suddenly, you're thrust onto the relentless merry-go-round of follow-up appointments. More scans, specialist consultations, potentially invasive biopsies. All this frantic activity chases something that statistically was almost certainly never going to cause you any trouble. Why is this so much more problematic after 70? Firstly, the older body simply doesn't bounce back like it used to. A biopsy that might have been a minor outpatient procedure at 45 can now lead to serious complications like a collapsed lung, a stubborn infection, or weeks of exhausting recovery. Even the seemingly simple act of lying perfectly still for an extended MRI can be physically grueling or intensely painful for older joints and backs. Secondly, the emotional toll is massive and often severely underestimated. Seniors frequently carry a heavier burden of health anxiety. Being told there's a finding, even if it's likely benign, can cast a long shadow of worry, robbing them of peace and enjoyment in their otherwise good health. This constant state of what if is corrosive to well-being. Betty's story, shared during a senior health workshop, illustrates this perfectly. At 78, Betty was vibrant. She walked daily, gardened, and had absolutely no health complaints. At a local health fair, a mobile clinic offered a deeply discounted, comprehensive full-body CT scan. Intrigued by the promise of reassurance, she signed up. The scan found a tiny, completely asymptomatic lesion on her kidney, so small it hadn't caused any issues and, according to radiology studies, had an extremely high probability of remaining harmless indefinitely. But the word lesion was enough. Panic set in. Pressured by the fear of cancer and well-meaning but aggressive recommendations, she underwent surgery within a month. The aftermath? Months of painful recovery, a significant and permanent drop in her energy levels, and lingering complications that subtly but persistently eroded her independence. All of this for something that almost certainly would never have impacted her life. Medically, this is termed overdiagnosis. Emotionally, it's unnecessary fear and suffering. Financially, it's often a drain, as these scans are rarely covered by insurance for asymptomatic individuals. Many seniors pay thousands out of pocket, believing they're buying peace of mind, only to purchase a costly ticket into a complex medical maze that may generate endless tests and procedures without clear benefit. True responsibility for your health in this chapter of life looks different. It means cultivating trust in your body and its signals. It means prioritizing how you feel over what a machine might show. It means recognizing that not every shadow on a screen deserves your precious energy, your peace of mind, or your willingness to undergo risky interventions. Wisdom lies in discerning when technology serves you and when it might inadvertently harm you. If you're finding these insights resonate, please comment number 2 below. It helps us know this is valuable. And if you haven't subscribed yet, please consider subscribing and turning on notifications. Your support fuels our mission to bring important, balanced health information to you. Now, let's move forward. Number 3. The overuse of cardiac stress tests for decades. The treadmill stress test has been a cornerstone of cardiac screening, especially for older adults. The logic seems straightforward. Put your heart under controlled physical stress, walking on a treadmill that gets progressively harder, and see how it responds. Monitor the electrical activity, EKG, blood pressure, and symptoms. The goal? Uncover hidden heart disease. But after age 70, this seemingly simple logic can backfire in ways many seniors don't realize until it's too late. What was once a potentially useful tool in your 50s and early 60s becomes a source of questionable value and significant potential danger once you pass a certain age. The primary issue with cardiac stress tests in seniors, particularly those without symptoms, is their high rate of false positives. This means the test results often suggest a significant heart problem when, in reality, the heart is functioning adequately for the person's age and activity level. Why does this happen so frequently? As we age, our cardiovascular system undergoes natural changes. Arteries stiffen, arteriosclerosis. Blood pressure regulation becomes less precise, and the heart's electrical pathways can show minor, non-dangerous variations. These are often normal consequences of aging, not signs of impending doom. However, the stress test isn't sophisticated enough to reliably distinguish these benign age-related changes from genuinely dangerous blockages. An unusual EKG pattern or a blood pressure drop during the test can trigger alarm bells, setting off a cascade of fear and further, more invasive testing. This cascade is where the real danger lies for older adults. A borderline or abnormal stress test typically leads to referrals to cardiologists and often prompts procedures like nuclear stress tests, using radioactive dye, echocardiograms under stress, or the big one, coronary angiograms, cardiac catheterization. Angiograms involve threading a catheter into the heart arteries, injecting dye, and taking x-rays. These procedures carry real and significant risks, especially for seniors. Bleeding at the catheter site, stroke, kidney damage from the contrast dye, a major concern for those with even mild age-related kidney decline, dangerous drops in blood pressure, and allergic reactions. Recovery is harder. And if the angiogram shows any narrowing, which is incredibly common in older adults, even if it's not causing symptoms, the pressure to intervene with stents or even bypass surgery becomes immense. These surgeries carry exponentially higher risks of complications, prolonged recovery, and loss of independence for older patients. You start with a treadmill and can end up facing major heart surgery for a blockage that wasn't actually causing you any problems. Harold's story is a stark example. A 76-year-old retired mechanic, Harold felt great. He walked his dog daily, played actively with his grandkids, and had no chest pain, shortness of breath, or unusual fatigue. At his annual physical, his doctor, just to be thorough, ordered a routine stress test. The results showed a minor abnormality. This led to a cardiology referral, then a cardiac catheterization. The angiogram revealed some mild, non-flow limiting plaque, essentially narrowings that weren't severe enough to significantly reduce blood flow or cause symptoms. Despite this, the cardiologist recommended placing a stent just to be safe. After the stent procedure, Harold developed a serious complication from the required blood thinners, internal bleeding. He landed in the hospital, required transfusions, and spent the next 3 months in rehab, his strength and vitality severely diminished. All triggered by a stress test he didn't need, chasing a problem that wasn't limiting his life. Leading cardiology bodies, including the American College of Cardiology and the American Heart Association, along with geriatric specialists, increasingly advise against routine stress testing in asymptomatic older adults. Major studies, like those reviewed by the USPSTF, consistently show that such testing in people without symptoms does not reduce heart attacks or overall mortality. It simply doesn't save lives in this group. However, it does significantly increase the risk of harm through the diagnostic and treatment cascade it initiates. The smarter, safer path is unequivocally symptom-based care. If you experience warning signs like chest pain or pressure, especially with exertion, unexplained shortness of breath doing activities you used to handle easily, dizziness, or sudden profound fatigue, then cardiac evaluation, potentially including a stress test, is absolutely warranted. But if you're feeling steady, maintaining your usual activity level, sleeping well, and breathing comfortably, your body is giving you the most reliable report card. Trust it. Aging wisely involves a crucial shift in perspective. From aggressively seeking out and fixing every possible problem to thoughtfully observing, managing symptoms that actually affect your life, and fiercely protecting your quality of life, energy, and independence. It's not about giving up on heart health. It's about focusing on what truly sustains it. Regular gentle movement, like walking, a heart-healthy diet, stress management, social connection, and good sleep. Protecting yourself from unnecessary medical intervention is a powerful act of self-care after 70. Number 4. The hidden harms of routine bone density scans, DXA, and the osteoporosis medication, push bone density scans, DEXA scans, are ubiquitous for older adults, particularly women. The message is clear. Find osteoporosis, porous bones, early, treat it with medication, and prevent debilitating fractures. It sounds perfectly logical. However, for many seniors without specific risk factors, The routine push for DEXA scans and the subsequent automatic prescription of powerful bone drugs can be a path fraught with unexpected risks and minimal benefit. The equation of scan plus drug equals fracture prevention is far more complex and potentially harmful than commonly presented, especially after 75 or 80. DEXA scans measure bone mineral density, BMD, giving a T-score comparing your bones to a young adult peak. The problem? BMD is just one factor in fracture risk. As we age into our late 70s and 80s, the biggest risk factor for fractures isn't just slightly lower BMD, it's the increased likelihood of falling. Factors like poor balance, muscle weakness, vision problems, medication side effects, dizziness, and home hazards become paramount. Focusing solely on BMD via a scan misses this critical picture. Furthermore, DEXA scans often label seniors with osteopenia, low bone mass, not full osteoporosis, or even mild osteoporosis. While this sounds alarming, the actual risk of a major fracture, like a hip, from mild age-related bone loss in someone without prior fractures is often surprisingly low over a 5 to 10-year period. The greater danger arises from the reflexive prescription of osteoporosis medications, particularly bisphosphonates like Fosamax, Boniva, Reclast, or even more potent drugs like Prolia, based solely on a DEXA number in an otherwise low-risk older individual. These drugs carry significant potential side effects that are particularly concerning for seniors. Bisphosphonates, known for causing severe heartburn and esophageal irritation, risky for swallowing issues. More alarmingly, long-term use, beyond 3 to 5 years, is linked to rare but serious complications like atypical femur fractures, sudden breaks in the thigh bone, and osteonecrosis of the jaw, bone death in the jaw, often triggered by dental work. These risks increase with longer duration of use. Prolia, denosumab, while effective, stopping it can lead to a rapid, severe rebound loss of bone density and increased fracture risk, sometimes multiple vertebral fractures occurring quickly. This makes it a potentially lifelong commitment with complex implications for very old adults. General side effects. Bone drugs can cause significant muscle and joint pain, flu-like symptoms, and fatigue, directly impacting mobility and quality of life, the very things we aim to preserve. Consider Marge, an 82-year-old avid gardener. She had a minor wrist fracture from a slip years ago, but was otherwise robust. A routine DEXA scan showed osteopenia. Her doctor, citing standard guidelines, insisted she start a bisphosphonate to prevent a hip fracture. Within months, Marge developed severe, unrelenting heartburn and muscle aches. Gardening became painful. She stopped the drug worried. A year later, she tripped on a rug and fractured her hip. The investigation revealed the initial wrist fracture and her age were moderate risk factors, but the biggest factor was a loose rug and slightly dim lighting. Fall risks completely unaddressed while the focus was solely on her bone density number. The medication caused significant discomfort without demonstrably preventing her fall-related fracture. What's the better approach? For seniors over 75 to 80 without a history of fragility fractures, breaking a bone from a minor fall. The focus should shift dramatically. Fall prevention is paramount. This is the most effective fracture prevention strategy. It involves home safety assessments, removing rugs, improving lighting, grab bars, balance and strength training. Tai Chi is excellent. Vision checks, medication reviews, reducing sedatives or blood pressure meds that cause dizziness, and using canes/walkers if needed. Adequate calcium and vitamin D. Ensuring sufficient intake through diet and supplements is crucial and far safer first-line support for bone health than medication. Individualized DEXA use. Scans should be used thoughtfully, not routinely, especially after 80. They are most useful for diagnosing osteoporosis in someone with a fragility fracture or significant risk factors, like long-term steroid use, or to monitor known severe osteoporosis if treatment is planned. For many active seniors without fractures, the scan result often doesn't change the core recommendation: prevent falls and ensure nutrition. Shared decision-making for meds. If osteoporosis is diagnosed and fracture risk is deemed high based on overall health and fall risk, not just the DEXA number, then a careful discussion about medication risks versus benefits specific to that individual's life expectancy and goals is essential. Often, the harms outweigh the benefits for those with limited life expectancy or high sensitivity to side effects. The goal isn't to ignore bone health. It's to prioritize strategies that offer the greatest real-world benefit with the least harm. Preventing a fall prevents the fracture far more effectively than marginally increasing bone density in someone highly likely to fall. Protect your foundation, your balance, strength, and safe environment before chasing a number on a scan that might lead you down a risky medication path. If this perspective on bone health makes sense, comment number 4 below. Subscribing helps us keep this vital conversation going. Now, let's look at the final test. Number 5. The PSA test pitfall for prostate cancer in older men. The PSA, prostate-specific antigen blood test, is perhaps one of the most controversial routine screenings for older men. Marketed for years as a simple way to catch prostate cancer early, the reality for men over 70 and especially over 75, is far more complex and often tilted towards significant harm. While detecting aggressive prostate cancer early can be life-saving for younger men, the vast majority of prostate cancers found by PSA screening in older men are slow-growing and unlikely to ever cause symptoms or shorten their lives. The PSA test itself is a simple blood draw, harmless in isolation. The danger lies entirely in what follows a high result: a cascade of anxiety, invasive biopsies, and aggressive treatments for cancers that didn't need finding or treating. PSA levels naturally rise with age due to benign prostate enlargement, BPH, a near-universal condition in older men. Inflammation, recent sexual activity, or even a bike ride can also cause temporary spikes. This makes the test notoriously unreliable. An elevated PSA in a 75-year-old is far more likely to signal BPH than aggressive cancer. However, an elevated PSA almost invariably triggers a prostate biopsy. This procedure involves inserting needles through the rectum to take tissue samples. Risks include infection, sometimes severe, requiring hospitalization, bleeding, and significant pain. Crucially, biopsies can find small amounts of low-grade cancer, Gleason 6, cancers that guidelines now clearly state should not even be called cancer because they are so indolent. Finding them is overdiagnosis. This is where the profound harm occurs. Faced with a cancer diagnosis, even a low-grade one, most men and their doctors feel immense pressure to do something. This often leads to aggressive treatments, surgery, prostatectomy, or radiation. Both carry life-altering risks that are particularly devastating for older men. Surgery: high risk of permanent urinary incontinence, leaking urine, and erectile dysfunction. Major surgery also carries risks of infection, blood clots, heart problems, and a long, difficult recovery period. Radiation: risks include bowel problems, diarrhea, bleeding, urinary issues, erectile dysfunction, and fatigue. Radiation can also damage nearby tissues. General impact: both treatments significantly impact quality of life, independence, dignity, sexual intimacy, and overall well-being. The recovery can be physically draining and emotionally taxing. Studies are unequivocal. For men over 70, and especially those with a life expectancy of less than 10 to 15 years, which includes most men over 75. PSA screening and subsequent treatment for low-grade cancer do not reduce the risk of dying from prostate cancer. However, they dramatically increase the risk of suffering significant side effects from unnecessary treatments. Research published in major journals like the New England Journal of Medicine and by the USPSTF confirms that the harms of PSA-based screening outweigh the benefits for men over 70. The USPSTF specifically recommends against PSA screening for men over 70. Frank's story is heartbreakingly common. A healthy 78-year-old, Frank was pressured into a PSA test during a routine physical because it's standard. His PSA was slightly elevated. A biopsy found a very small, low-grade Gleason 6 cancer. Terrified by the C word, Frank opted for surgery, urged on by a urologist emphasizing getting it out. Post-surgery, Frank struggled with severe incontinence, needing pads constantly. He also lost erectile function. The depression and loss of dignity he experienced were profound. Years later, his son, an oncologist, reviewed the records and confirmed the cancer was almost certainly harmless. Frank had traded his active, continent life for treatment he never needed. What's the better path for men over 70? Know the numbers and guidelines. Understand that major health bodies recommend against routine PSA screening starting at age 70 or earlier for some men without risk factors. The USPSTF gives it a D rating, not recommended, for men over 70. Symptom awareness. Be vigilant for actual symptoms that might indicate a problem needing investigation. New, persistent difficulty urinating, weak urine stream, blood in urine or semen, frequent urination, especially at night, or new bone pain if cancer spreads, which is rare for slow types. These warrant investigation, which might include a PSA test as part of the diagnostic workup. Share decision-making. If considering screening, if a man over 70 insists on screening after understanding the risks, or has specific high-risk factors, strong family history, African American descent, it must involve a brutally honest conversation. He needs to understand the high chance of false positive or finding harmless cancer, the risks of biopsy, the significant side effects of treatment, incontinence, impotence, the very low chance that finding and treating a cancer will extend his life if he's over 75 or has other health conditions. The alternative, active surveillance for low-grade cancer if found, regular monitoring without immediate treatment. Focus on health span, prioritize healthy lifestyle factors that support overall well-being and may positively impact prostate health. Healthy weight, exercise, diet rich in fruits/vegetables. For the vast majority of men over 70, declining the routine PSA test is not neglect. It's a powerful act of self-preservation. It protects you from a diagnostic and treatment pathway that is far more likely to harm your quality of life than to meaningfully extend it. It's choosing peace of mind and well-being now over chasing a statistical ghost of a threat that likely won't impact your life. If this critical perspective on PSA testing resonates, please comment number 5 below. Subscribing ensures you get more insights for empowered health choices. Final thoughts. Choosing wisely in your wisdom years growing older doesn't mean growing helpless or passive about your health. If anything, these are the years when we finally gather the wisdom, the lived experience, and often the courage to question the system, to slow down, and to ask firmly but respectfully, is this test, this procedure, this pill really for me? Will it help me live better, or just add burdens? You see, in a world relentlessly focused on more checkups, more screenings, more pills, more interventions, the bravest, most profound choice can sometimes be choosing less. Not out of fear or neglect, but out of deep understanding, out of knowing your own body intimately, honoring your core values, and staying fiercely focused on your personal goals for how you want to live your days. Healthcare in your 70s, 80s, and beyond shouldn't be a conveyor belt of automatic tests and impersonal routines dictated solely by generic guidelines designed for younger populations. It must be an ongoing, collaborative conversation between you and your doctor, ideally one experienced in geriatrics, about what matters most to you. What does living well truly mean for you? Is it tending your garden, playing with grandchildren, reading, traveling, or simply enjoying quiet mornings in peace? How much risk are you truly willing to accept from medical interventions in pursuit of potential, but uncertain, extra time? What burdens, side effects, recovery time, loss of independence are you unwilling to bear? Blindly following protocols designed for 50-year-olds can actively rob you of the vitality, peace of mind, and precious time you have right now. It's not because doctors intend harm. Most are deeply caring. It's because they operate within a healthcare system historically geared towards disease detection and intervention, sometimes at the expense of holistic well-being and quality of life, especially in older age. The system often chases potential future diseases rather than honoring and supporting the health you currently possess. If this video has made you pause, made you think twice about the next screening offer, or given you a new lens through which to view your health decisions, then it's already served its purpose. Remember this: saying no, or let's discuss this further, to certain tests isn't ignoring your health. It's the essence of being deliberate and empowered. It means weighing the true potential benefit against the real burden, physically, emotionally, and financially. It means recognizing that not every test leads to clarity. Some lead straight into the bewildering, anxiety-inducing maze of overdiagnosis, unnecessary procedures, and treatments that steal your present well-being for a highly uncertain future gain. So, take ownership of your health journey. Talk openly with your doctor. Ask the crucial questions: what is the specific benefit of this test for someone my age and in my health? How likely is it to change what you do or how I feel? What are the real risks and downsides for me? What happens if we don't do it? Are there simpler, safer ways to monitor this? Think deeply about your time, your energy, your comfort, and your independence. Because at this stage of life, these are your most precious currencies. You have earned, through every year of your life, the absolute right to live on your terms, thoughtfully, not fearfully, empowered with knowledge, not overloaded with procedures. Focused on creating a life rich in meaning, joy, connection, and peace, rather than constantly preparing for sicknesses that may never come. Protect your vitality. Cherish your peace. Choose wisely. Thank you for joining us on this important exploration. We genuinely value your thoughts and experiences. Please leave a comment below sharing one insight you gained today and how you might approach your health choices differently. Your perspective enriches this vital conversation for everyone. If this video helped you see your health in a new light, please give it a thumbs up. It means a lot. And if you haven't already, please subscribe and hit the notification bell. Your support allows us to continue creating honest, empowering content to help you navigate health and aging with confidence and clarity. Thanks for watching, and we look forward to sharing more with you soon.